Australia has 200 fewer ICU beds. Let's have a look. Hello everyone, Florian.heise here, and welcome to another episode of HeiseSays. Grab your stein of coffee. I want to look at this article from The Guardian. Apparently we've got 200 fewer intensive care beds than at the start of the pandemic. Now remember, recently we looked at some footage where Victoria was planning to build 4,000 new ICU beds. And, of course, Dan Andrews is shown lying, saying they never agreed to that. As funny as that is, it's kind of ludicrous, the idea that they could actually build that much capacity in such a short time. I mean, China probably could, honestly, but I don't know if we could pull that off here in Australia. So let's have a look at this article, guys. Australia has 200 fewer intensive care beds than at the start of the pandemic. Figures provided by the Federal Health Department show an 8% drop in the number of beds, with regional areas the worst affected. And this is the main issue with regards to the coronavirus. It is the fact that ICU stays for people with this illness are drastically longer than anything else. And that's why they're concerned about getting flooded and our system getting overwhelmed. Whereas if you need intensive care for other medical reasons, there'll be no capacity. That's the only reason I can see why they're having this reaction. So, Australia has almost 200 fewer ICU beds available this year than at the beginning of the pandemic, making regional areas in some states vulnerable to the looming surge of COVID cases, a national intensive care survey has found. The findings of the survey, completed by the Australian and New Zealand Intensive Care Society, the Federal Health Department, were provided to National Cabinet last month as state and territory leaders prepare for the easing of restrictions with the COVID in the community. The updated data on the number of intensive care beds shows that a total of 2,183 staffed ICU beds were available in Australia at the end of August, 8.2% fewer than the 2,378 available in March 2020. In regional areas where vaccination rates are lagging, the number of available intensive care beds has dropped by 18% over the same period to just 262. Edward Litton, lead author of the ANZICS report, which was published in the Medical Journal of Australia on Wednesday, said bed numbers were down compared with 18 months ago because of the pandemic's hit to the workforce. Undoubtedly, beds are down, and those are staffed operational beds, and I think that's a consequence of COVID on our workforce, on our critical care workforce, he told The Guardian. This included the movement of staff to vaccination clinics, the furloughing of staff, work restrictions, the cancellation of elective surgery, and in some cases, the redevelopment of ICU infrastructure. Litton said the drop in the availability of beds in regional and rural areas was a concern to ANZICS, and workforce issues needed to be urgently addressed to ensure the sector could meet the expected surge in demand. What concerns me is the rural and regional areas and the fact that there remain substantial variations between states, he said. As a community, we need to ensure that we're able to provide equally as high quality care to those in rural and regional areas as in our metropolitan areas, he said. Is that even possible? That's why you have flying doctors and helicopters to bring people from the rural, remote areas to the better staffed and more equipped and larger hospitals in the city. It's never going to be the same. The survey of 194 intensive care units found that in the event of surging demand arising from COVID outbreaks, hospitals were theoretically able to ramp up the number of beds to a total of 5,623 beds, an extra 3,440 beds, or a 150% increase. This included a total of 813 extra ICU beds within existing departments and an extra 2,627 beds in surge areas outside of ICUs. However, the survey found that because of staffing constraints, only 383 of these extra beds could be adequately staffed, based on a pre-pandemic ratio of 4.91 full-time registered nurses per available ICU bed. ICU capacity can be increased in response to high demands, but is ultimately constrained by the availability of appropriate staff, the report concluded. The forecast surge capacity is also lower than found in the survey of March 2020, which reported the ability of ICU wards to increase bed availability by 191%. The report highlights a vast difference between states and territories on the availability of extra resources and calls for urgent strategies to maximise the availability of staff for areas of high demand. New South Wales has the highest number of available staffed ICU beds at a ratio of 10.8 per 100,000 people, followed by South Australia at 9.1, ACT 8.6, NT at 8.1, Queensland 7.1, Queensland 7.9, Victoria 7.1, and Tasmania at 7. West Australia, which is attempting to remain COVID-free by keeping its borders closed to the eastern states, has the lowest number of ICU beds in the country at 6 per 100,000 people. I'm sure they could convert all those mine first aid centres into ICUs. That's a joke, by the way, guys. There's a lot involved in ICU. Lytton said the differences between states and ICU bed numbers per population could see those jurisdictions with low capacity particularly vulnerable to increased strain as public health restrictions ease. New South Wales, actually in terms of their preparedness with their staffing, had the best numbers of beds per population of anywhere in Australia, so they were best placed to be able to deal with this. Other states are perhaps not quite as adequately resourced. ANZIC's paper said efforts to address workforce shortages are needed, which Lytton said could include paying nursing staff more to ensure the sector remained attractive. The paper said the pandemic had been associated with substantial psychological distress, including anxiety and burnout among Australian healthcare workers. And well, we've even seen that in the comments on many of the videos I've done from people who are working in that field. What's his name? Max, registered nurse working out in Ipswich, has shared several times some of the stresses and issues. How's it going, mate? Let us know in the comments if it's getting any better. I mean, here in Queensland, we're quite fortunate. There's not much of the pandemic around. You can live day to day pretty normally. So, here's the hospitalisation rate in Victoria. I mean, there you go. This is the issue. Oh, they're all going to COVID live now. There you go. Lytton said the demands of the pandemic had seen existing workforce working more hours, but this is not a sustainable model. That's not a reasonable model just to continue to ask those on the front line just to do more. And so I think it's about our investment in our nursing workforce in particular, ensuring that the high standard of care that they deliver and the training that they receive is adequately recognised and that pathway remains attractive, he said. While staffing constraints persist in the sector, the report noted that equipment shortages identified last year have since been more than overcome, and there are now sufficient ventilators for every ICU beds. So the issue is staffing. The release of the ANZIC's figures come as New South Wales fast approaches the 80% double-dose vaccination rate as it begins to ease restrictions with hospital admissions for COVID lower than initially forecast. Burnett Institute modelling released early in September predicted New South Wales hospitals would peak about 3,900 patients, including non-COVID patients, in mid to late October, with the number of people in intensive care peaking at 947 in the beginning of November. As at October 12th, there are 565 COVID cases being treated in hospital, with an additional 148 cases in ICU. This is on top of the 6,174 cases being cared for at home. They're probably caring for themselves. The number of cases is expected to surge when restrictions are lifted next month and COVID patients take longer to recover. In September, the Federal Health Minister, Greg Hunt, said he was confident that the state hospital system was prepared for the forthcoming surge in demand arising from COVID outbreaks once the country moved into the next phase of the national plan. We have the ventilation capacity and the ICU capacity. The thing which in particular that Professor Brendan Murphy had been coordinating with all of the states is to make sure that workforce is in place, Hunt said. But we have strong confidence in all of the states and territories to meet the surges as they come. Alison McMillan, the Chief Nursing and Midwifery Officer for Australia, said the department was looking at ways to boost workforce availability for surge demand, including training more nurses for intensive care work and encouraging some back out of retirement. Oh, boy. Could you imagine that? A retired nurse. I mean, they'd be tough as nails. They would not take any shit. Oh, boy. I mean, don't get me wrong. They can switch the bedside manner on. Most of them, like a bloody tap. But, oh, boy. I don't know. I just heard too many stories of kids who've got nurses and mothers sent to school with broken arms. Stop complaining. A whole range of options about how we can surge and, if necessary, mechanisms to share staff across the country if we were needed to do that through emergency management arrangements. So there we have it, everyone. Let's have a bit of a talk about this. So it looks like they have the surge capacity. This is more so to do with staffing. Well, maybe we can see why there calls for 2 million new migrants into Australia, guys. What do you reckon? As always, let me know your thoughts on this one. Would you consider coming out of retirement as a nurse? I mean, the hours are terrible. You don't get to spend much time with your family. And some people treat you terribly in that environment. It's a stressful situation. Plus you're risking getting sick. It'll be tough. As always, thanks for watching. If you're a fan and enjoy the content I find and put together here, there are a few ways you can help out. You can join us on YouTube or Patreon. Sign up for SelfWealth or Stake. Use our affiliate links at Amazon, eBay, Independent Reserve, or AussieBroadband. You can buy our merch from HeiseSays, use Gold Pass from the Perth Mint, or support us via PayPal. Take care. I'll see you all next time. Bye for now.